Zookeeper and author Bindi Irwin, the daughter of the late TV conservationist Steve Irwin, is sharing a message with women about her health and which she underwent a surgery for endometriosis. Posting on Instagram, she details struggling for a decade with symptoms. Irwin urges women to keep searching for answers, pointing to the stigma surrounding the disease. What are the most overlooked symptoms, and how much can this disease and other conditions set back women for their health and their fertility? We are joined now by Allegheny Health Network Center for Reproductive Medicine, Dr. Terrance Lewis. Doctor, thank you so much for taking the time today.
Absolutely. Thanks for having me.
Yeah, women have a lot of questions about these subjects. So what are the most common symptoms when you look at endometriosis?
Sure. Women with endometriosis typically suffer with what we call dysmenorrhea, so very painful menstrual cycles. They can also suffer with infertility, difficulties conceiving a pregnancy. And many women with endometriosis report pain with intercourse.
And the FDA says endometriosis may affect more than 11% of women, but there could be more. How does that end up going undiagnosed for some women for longer periods of time?
Yeah, very interesting question. So women with endometriosis vary in the way they present. There are some women that have endometriosis and we don't know until we go in for surgery. So they don't have any painful menstrual cycles. They don't have pain with intercourse. We learn when we go into their abdomen for a different reason. Whereas others have lots of pain. And so just with the varying symptomatology that we see in this disease, that just predisposes some women to kind of living longer without a diagnosis.
All right, another condition that's getting a lot of attention lately on social media is PCOS. What is that and how does that impact fertility?
Sure. PCOS stands for polycystic ovarian syndrome. And this is a syndrome that is really, we think about women that have irregular menstrual cycles. They can also have signs of elevated androgens, so acne or hair growth in a male pattern. And they also typically have polycystic appearing ovaries on ultrasound.
Now, are those conditions easy to treat when you look at endometriosis and PCOS?
Yes, yeah. Women with PCOS, if they have irregular menstrual cycles, the goal is really to kind of help regulate their menstrual cycles. And so we do that with a variety of medications. And we often see those women have successful, healthy pregnancies.
Oh, wow. And with endometriosis, is that harder, or would you say it's also medicine that you can use to treat that?
Yes, yeah, endometriosis, it does make it more difficult for women to conceive. And when we look at large studies, women with endometriosis have poorer reproductive outcomes than any other subfertile group. And so we help women often here with ovulation induction. Sometimes it requires women undergoing in vitro fertilization, but we are able to help these women oftentimes.
And social media is flooded with influencers who offer health advice, diet suggestions for women who have these conditions or these diseases. Do you believe those influencers and their suggestions could be helpful, or would you urge caution?
Sure, I would urge caution anytime you're getting information from social media. Very good resources are the American Society for Reproductive Medicine. They have a patient portal on their website that is free of charge. Also, the American College of Obstetricians and Gynecologists, ACOG, they have a free patient portal. So I always encourage my patients to go directly to those sources for their information.
And women watching this now, they may wonder, well, when do I reach out to a doctor if I'm having symptoms or trouble with fertility? At what point in the timeline should someone schedule an appointment?
Yeah, good question. So if a woman has irregular menstrual cycles, meaning their cycles don't come predictably, they can schedule an immediate referral.
Thank you so much for giving us some of your advice.
Absolutely. Thanks for having me.